been able to do hair restoration on autoimmune problems that lead to scarring of the scalp or permanent loss of hair follicles. And for us to answer that question, it is important that we go back and look at what are some of the most common autoimmune problems that we see and that affect the Afro-ethnic woman and the Afro-ethnic man. Now, I will talk about three common situations that we're seeing that are carrying hair and scalp conditions. One, we have the most common that affects Black women, and that is CCCA. This is a condition that is triggered by, or claimed to have been triggered by, chemicals, the use of chemical relaxers, dyes with very strong chemical structures. Then we have lichen planopilaris, which is an autoimmune problem. In these situations, idiopathic activity makes the white blood cells start attacking your hair follicles and decimating the hair follicles, leading to permanent loss of hair. Then we have things like frontal fibrosing, another condition that really affects the face. Patients going through that problem will have malarash. You will see darkening of the cheekbones and around the eyebrows as well, and under the eyes. Those areas become dark and it looks like you have sunburn, but in reality is a condition where you lose hair along the hairline. You see your hair growing on tiny little pimplets, and then it affects your face as well. So these are some of the situations that can be triggered by stress. And when we say stress, it's a huge spectrum. It could be any imbalance in the body. Maybe you're eating wheat and you gluten intolerance. Maybe you're drinking milk and you have lactose intolerance. Or maybe you're simply overworking yourself. You're not sleeping enough. You're pushing a little more at work. We've seen students, people studying and preparing for exams, ending up losing hair because then there is an imbalance in the body system. So these are some of the most common scarring conditions that I see in the clinic. And sometimes the client or the patient comes in when they've lost significant amount of hair follicles. And please note, I'm not saying amount of hair, but amount of hair follicles, because you can lose hair. As long as you have hair follicles, you can always regrow the hair. But the moment you lose hair follicles, then it becomes a scarring situation. Scarring means that the hair follicle structure is decimated, and then the skin fills up that area with a scar tissue. It becomes smooth, it becomes shiny, and hair loss is permanent. Originally, people never used to touch scarring conditions with hair transplants, for instance, to try and restore hair where hair follicles have been lost, because the moment you lose hair follicles, the only way then you will get hair growing in that area is by reintroducing new hair follicles. And we took the risk, I think, back in 2022, and we said, look, why don't we treat, as long as the patient has come in and they've responded very well to a particular therapy or a particular combination of therapies that has helped to stop further inflammation and the scalp is settled, they're showing proper hair growth. Although we know an autoimmune problem is not something that you can treat permanently, but you can always manage. So you need first to get a diagnosis, establish that yes, this person has lichen planopilaris, or they have frontal fibrosing, or they have central centrifugal cicatricial alopecia. And then you work on a combination of therapies that will then help the patient to stop further loss of hair. So once we worked on patients and we were getting good progress and the scalp becomes very settled, then we decided, look, why don't we do a pilot hair transplant where we take a small spot of the affected area, we plant a few hair follicles. I'm talking about a figure like 25 to 30 hair follicles. And then we give it time, like 12 weeks or so. Within that period, we were able to tell, are we getting more than 75% or 70% growth of the hair that was transplanted? And if we get that, it means that the scalp is in a position to support hair growth. So this would then give us the go-ahead to work on the area of hair loss. But again, because this is an autoimmune problem, we do not know what would be a trigger to further hair loss. Then what I used to do is my team and I would work on half of the area. For instance, if someone comes and they are frontal fibrosing, they've lost their hair from one side to the other side. We've done a pilot hair transplant. They've responded well to that pilot. Then we would go back in and work on like 50% of the area that has lost hair. Why are we doing this? You do not want to go in gung-ho and work on the whole area, because if an inflammatory situation was to recur because of the hair transplant, because that could actually be a trigger, you do not know, and we cannot tell what will be a trigger to the situation. So if the process itself of transplanting hair and healing process is translated to as a trigger, by the skin and you start getting inflammation again, then you will not lose so much hair follicles, so much money if you just worked on half of the area that had lost hair. So yeah, the protocol was clear that we get the diagnosis of problem, we treat that problem, manage it to calm the scalp down, and once we're sure that this scalp is settled and not showing any further inflammation, then we'll go ahead and do a pilot hair transplant where we introduce like 30 hair follicles in a particular spot, give it 12 weeks, the patient responds very well, then we'll work on half of the area of hair loss, at least to make sure that we protect the follicles that we put in place, we protect the financial aspect of the patient. And then once they've responded well, because within 6 months, you'll be able to tell what is the traction levels, how are they responding to the hair transplants, and then the back area is recovered completely and you can go in and harvest more for the other area. So those are some of the critical things that we had to look at and make a decision and say, look, we have quite a number of patients who are going through central centrifugal cicatricial alopecia. Na vile mnajua wa Kenya, we like waiting until the very last time so that we come and say, hey, look, my hair loss is, I've tried this, I've applied onion, I've applied wheat rice and all, honey and kitungu saumu and all these things. And when it doesn't work and you're losing more hair, that's when you'll say, let me give these guys a try. So most of the time the patient comes in when it's too late. I mean, they've lost a significant amount of hair follicles, and that means that you have to start thinking of replacing them. Now, if these conditions are picked in good time, then we can manage them and you will not need to go to that extra step of having to go through a process of then restoring the hair that was lost. So in a nutshell, we're saying that we have been able to restore permanent lost hair in conditions of autoimmune problem. And you can see I'm sharing images of people with lichen planopilaris, have some of them. You see the images that I'm sharing. Some people we've worked on half of the area of hair loss, others are pilots, and you can see others with full heads of hair growth. So the critical thing really when you're losing hair is make sure you avoid shooting in the dark. Understand what is the condition. Then that will help you to formulate the proper management plan. And after that management plan, if the scalp completely settles, and I'm saying if because there are autoimmune problems that you try to manage, and then the client will not respond to it because it's a huge spectrum. I just said a patient who every time she drinks alcohol, it flares up. She had to stop that because of barley, stop wheat, stop milk products that have lactose. And she simply responded well. Even after months of trying to manage it, we had to sit and say, look, we are not helping this situation. Here we are trying to treat and we're not seeing progress. So the critical thing is really to make sure that you get something that settles the inflammation. Then you do a pilot hair transplant. See how you respond to the pilot hair transplant. If you're getting more than 70% growth, then that's thumbs up that you can actually go ahead and work on half of the area that has a problem. But remember, even after, during operation, post-operation, we have to make sure that inflammation or no inflammation, we proactively manage inflammation to protect the follicles that we've put in place and give them the best chance for them to have 100% traction. So these are some of the things we're doing at Hair Hub Trichology Center. We would be excited and happy to assist you if you're losing hair, or if you think you're losing hair, or your scalp has issues. Please make sure that you contact us. Come through. We will walk the journey with you. We will try and get a diagnosis. If we need to run more tests, if we need to do blood works, if we need to do biopsies to make sure that we nail on the diagnosis, because that is the starting point. And please subscribe to my channel to give us the opportunity to keep sharing more information about your hair health and about your scalp health. My name is Muli Musyoka, Chief Trichologist at Hair Hub Trichology Center. See you in the next video.